Part 1. Introduction. Private Health Insurance Rebate versus Medicare Levy Surcharge, Australian Families 2025-26. Should your family get private health insurance or just pay the Medicare Levy Surcharge? It's a question every Australian family asks at tax time. Today, I'm going to show you a simple Excel calculator I've built that answers this question instantly. No complicated math, no guesswork, just enter your family details and get the answer. Let me walk you through exactly how this calculator works. Part 2. The Calculator Overview. Here's the calculator. It's divided into 3 clear sections. 1, the yellow box at the top, this is where you enter your family's information. On the right, this is the reference table with the official ATO rates for 2025-26. And the box below, this shows the calculations and the final verdict. The beauty of this calculator is that everything updates automatically when you change any number. Let me show you how each part works. Part 3, the Input section. Let's start with the inputs. This is the only place you need to type anything. Cell C4, Family Combined Income. This is your total household income for MLS purposes. That's your taxable income, plus any fringe benefits and net investment losses. I've put $280,000 here as an example. Cell C5, Number of Dependent Children. This matters because the income thresholds increase if you have kids. I've entered 2 children. Cell C6, Age of Oldest on the policy. The rebate percentage increases once the oldest person on the policy turns 65. Our example is 38, so we're in the under 65 bracket. Cell C7, Annual Premium. This is the quote you got from your health fund before the government rebate. Let's say $4,500 for this family. Now, look here at columns E to I. This is the engine room of the calculator. I've built in the official ATO tiers for 2025-26. Column E lists the tier names: Base, Tier 1, Tier 2, and Tier 3. Column F shows the income thresholds. Notice Tier 1 starts at 200. These numbers come straight from the ATO. You don't need to touch this table, it's just there for reference and for the formulas to look up. Now for the interesting part, the calculations. Watch what happens as I walk you down column B. Cell B9 calculates your adjusted family income. It takes your income from C4 and adds $1,500 for every child after the first. With 2 children, that's $280,000 plus $1,500, giving us $281,500. This is the number used to determine your tier. Cell B10 identifies your tier. It looks at your adjusted income of $281,500 and compares it to the thresholds in the lookup table. You can see it returns Tier 2. Cell B11 pulls your MLS rate. Based on Tier 2, it returns 1.25% from the lookup table. Cell B12 calculates your MLS owing if you remain uninsured. This is the big one. It multiplies your actual income, $280,000, by the MLS rate, 1.25%. The result? $3,500. That's what this family would pay the ATO if they don't have hospital cover. Cell B13 finds your rebate percentage. Again, based on Tier 2 and under 65, it pulls 8.095% from the lookup table. Cell B14 calculates your rebate amount. It multiplies your premium, $4,500, by the rebate percentage, 8.095%, giving you $364. This is your net cost of insurance. That's your premium minus your rebate. $4,500 minus $364 equals $4,135. This is what the policy actually costs your family after the government helps out. And finally, Cell B16 delivers the verdict. It compares your net insurance cost, $4,135, against the MLS penalty, $3,500. Since $4,135 is greater than $3,500, the calculator tells us pay MLS, cheaper by $635.
In this example, this family would actually be $635 better off financially by not having private hospital cover and simply paying the Medicare levy surcharge. Part 6. Changing the scenario. But watch what happens when we change the numbers. I'll increase the family income to $350,000. Watch everything update automatically. Adjusted income in C9 jumps to $351,500. Tier in C10 becomes Tier 3. MLS rate in C11 becomes 1.5%. MLS owing in C12 shoots up to $5,250. Rebate in C13 drops to 0%. No rebate in Tier 3. Net insurance cost in C15 becomes the full premium, $4,500. And look at the verdict in C16. Now it says get insurance. You save $750. Same family, higher income, completely different answer. That's the power of this calculator.